Hello, hello, hello. My name is Jade Curtis. I am the host of the PulseBlackDoctor.org's newest video series, and I'm here with Dr. Enyia. Dr. Enyia, can you please introduce yourself?
Absolutely. Thank you so much for having me. I am Dr. Okey Enyia. I am a health policy executive with over 15 years of experience in the federal government relations space at the local, state, and federal levels. My background is in medicine, public health, and health policy, and it's really good to be here.
Absolutely. So you mentioned that you were in health policy. You're an executive for policy. Can you tell us what programs you're currently focused on and how they're impacting the Black community?
Sure. So currently what is being discussed in Congress is, from a health perspective, is Medicaid and the proposed $880 billion cut to Medicaid over the course of a decade. We know that there is a significant number of Black and brown people who need Medicaid, who need access to care. And we also know that health disparities and health inequities disproportionately impact Black and brown people. And so when we're talking about cutting a lifeline to access to care, you are asking for worse health outcomes, shorter life expectancy, and other issues. And so the goal is to ensure that we can preserve as much of the Medicaid coverage as is possible. Now, I'll also note that in my research, I'm focused on Black men's health. And so we also know that most Black people reside in the South, which also happens to have the worst health disparities than other regions around the country.
Wow, I didn't know that.
Yes.
Wow.
And so it's all connected in terms of what are called the social drivers of health. Mm-hmm. And that is part of what I'm using to root my lobbying and my advocacy efforts on Capitol Hill and on the ground.
I love that. I love that. I love that. And so with this change happening, what are some of the things that you're currently doing and that maybe even the community can do to maybe raise our voices and possibly get these things reversed? Or how can we even just advocate for ourselves at a strange time like this?
Great question. So I'm actually writing my second book.
Oh, really?
Yes. It is called the John Henry Health Equity Playbook.
Nice. Okay.
And it is a 4-year health policy agenda for Black men. And that book, I'm really excited to be launching it this fall here in DC. And it's a brain dump of my experience as a staffer on the Hill, having worked in the House and the Senate, also worked for the Department of Health and Human Services, who I've also worked for DC governments and for not-for-profit space. Coupled with my background with a doctorate in health policy, I'm able to serve as a scholar activist and a policymaker. And so the book at a high level helps people shape policy at the local, state, and federal level. And so it is full of tips, advice, strategies, tactics, plays in terms of how do we schedule time with staffers on the Hill or at the state level? How do we connect with key stakeholders with both quantitative and qualitative data? What stories can we tell key decision makers to help to persuade and to influence those who have the power of the purse to allocate funding and to put in place interventions that can help Black and brown people? So it's a fantastic read. I'm super excited for this book. This is not just a moment for me. This is a movement.
Absolutely. I love that. I love that. And we're all about turning our audience into advocates, teaching them how to stand up for themselves, how to speak up for themselves, how to use their voice. So I want to hear one key tip from your book. What is one thing that if they open the book right now and they only took one thing away from it, what would it be from that book?
One thing.
I know that's hard. I know that's so hard.
So I will frame it this way. So I am real big on civic engagement. And so one quote that I will leave you all with is that politics will impact you whether you want it to or not.
Okay.
Politics will impact you whether you want it to or not. So the question becomes, to what extent are you looking to engage in the policymaking process, in the civic engagement process, to ensure that your voice is heard? Because in fact, what is now emerging is there is a direct correlation between people who vote and health outcomes. And so the more that you are involved in the political making process, the better life you're able to live. And so that's also messaging that I'm using as I go around the country on conferences, podcasts, etc., to say, hey, here is what's happening. Here are the plays that you can run to ensure that your voice is heard.
Absolutely. So what I'm hearing is get to the polling booths, and not just every 4 years, but every opportunity, even local government, get in the polling booth because it makes an impact. So I know that you also mentioned that you are heavily involved in men's health.
Yes.
All right. I don't want to keep you much longer, but I do want like a key thing that all men need to know. What is one key focus area that I think, or that you think men are kind of ignoring, but need to really lean into? And I know that's a hard one too, especially for Black men. We love y'all, but y'all got to take care of yourself. So what are you thinking?
That as Black men, as brilliant Black men, we do have power. Question is, how do we get to a place where we are clear on how to wield that power in policy, in advocacy, in equity? It's about being comfortable and confident in walking in our greatness and walking in the fact that we are asset and have strengths and can bring value to any space. Because if you're not at the table, you're on the menu. So how can we show up as brilliant, thriving Black men in spaces, local, state, federal, boardroom, classroom, etc., advocating for our unique needs coming from an asset perspective to change the world?
Absolutely. And that's such a gem. And one of the things that I've loved over the past few years is the emphasis on Black men's mental health.
Yes.
So what are some things that we can do there even as women who are dating Black men, who are our fathers are Black men, our uncles? How can we, as women, as sisters, uplift our men during their lower times or when they're not feeling adequate, as you stated?
Sure. So, I always say that change starts with you, right? I am an example of having a robust self-care regimen, meaning I've been seeing a Black male psychologist for several years as part of my routine maintenance checkups, etc. I have an executive coach. I journal, I do breath work, yoga, acupuncture, chiropractor, gym, traveling. That's my self-care and soul care regimen. And it's critically important for me to discuss that as a Black male because it gives other brothers, other people permission to also share their stories. Now, what I always ask of my beautiful sisters is to also support us and to speak life into us. We need encouragement. We need support as well. And of course, it is reciprocal, right? And so it's being mindful of the ways in which we show up for each other and look forward to growing together and thriving.
Absolutely. Well, I want to thank you so much for your time and for hopping on our new series, The Pulse. We hope to see you again soon.
Thank you so much. Look forward to it.